So today we're going to be discussing the benefits of birth control. First, we're going to go over some of the uses of birth control. So typically, birth control, also known as contraceptives, is known for helping to prevent pregnancy in women. It's also known for helping to alleviate acne, also help to reduce menstrual pain, and also to help regulate menstrual cycles within women. When it comes to regulating the menstrual cycles in women, every woman does not have the typical period to come on every time at the exact time each month. Therefore, the birth control helps to regulate that, as well as hormone shifts within the body, and therefore it creates pimples, it creates acne, and that's how birth control helps with that. Also, it helps with pain. Many women do deal with extreme pain when it comes to their menstrual cycles, and birth control contraceptives have also been known to help alleviate that pain as well. So how has birth control become so controversial in the past years, and what has happened with that? So over the past years, there has been the ideas and the thoughts of pro-life and pro-choice. So pro-life is basically no abortion, as well as the thought of low to none access to birth control and being made to have a child that has been conceived. Whereas pro-life is the idea of definitely having access to birth control, definitely having access to abortion, and also being able to make the choice as to whether you would like to have the child that has been conceived or not. Who is this impacting? So basically, this is impacting any female who is able to bear a child. Also, any female who may be using birth control for other uses outside of being just sexually active. This is going to impact any of these women for the simple fact that some women would like to have the choice, and some women may want to have their child. But at the end of the day, these women would still be able to make the choice if birth control and abortion are still things that are accessible. And also with women who use birth control for other reasons, they can continue to have less menstrual cramps, they can start to have regular menstrual cycles, and they can also feel more confident within themselves to have less acne. 69% of surveyors in a survey said that they feel as though birth control should be covered in health plans, and it should also be covered within private insurance. Therefore, this means that a lot of women feel as though it is important for them to be able to have access to birth control so that they can make the decisions with their lives as they please. So how might the environment be affected by something such as this? So if anything with pro-life decided to go through within the government in the next year or so, women will not have the choice as to whether they would like to have their child or as to whether they may not like to have their child. This can lead to some children becoming orphans and being in child protective services. This can also lead to a lot of families depending on government welfare by not being financially stable enough to be able to take care of their child, ending up in poverty. And this is also going to impact women in their day-to-day lives. Like I said, the ones who aren't sexually active, the ones who have to deal with those cramps and still go to work and still go to school while that pain is awful, and also not being as comfortable in their skin, having to deal with acne when it's something that is alleviated through birth control, and also feeling yourself again by being able to have a consistent and regular menstrual cycle. So in this quote, it says, access to contraceptives improves internal, child, and maternal health. So basically here is just saying that overall, birth control is helpful, and being able to have the choice to access something like this is great internally for the long run. Yes, a lot of people may say with pro-life, it's not up to you to take a child's life and things like that. But at the end of the day, if someone's not ready, then they're just not ready. And it overall helps to improve maternal and child health. So, what does all of this mean for nurses or other professionals in the healthcare field? So if this was something that does end up passing and does go through, then healthcare professionals are going to have to go along with the choices of the government. If not, they're still able to give access to these individuals who need it. Thank you for listening to all of the benefits of birth control.